clients present to the emergency room, okay? Which client should be seen first? So the same thing. You look and analyze the question, seen first, and 4 clients. So this is a prioritization question, and you have to be sharp. You don't have to be expected, okay? So a client with acute diverticulitis will report left lower quadrant pain. Whenever they give you location, just be careful and make sure it's consistent with the disease. This is your right side. This is your left. So left lower is here. And what is here? Sigmoid. And that is where you have diverticulitis. So look at what they're telling you. The diagnosis doesn't matter. You can have heart failure. It doesn't matter. Don't get scared with the initial diagnosis. Look at the subsequent thing they're giving you, the subsequent information after the diagnosis. You have acute diverticulitis. Okay, fine. You report what? Left lower quadrant pain. There is no shock. There is no sepsis. I'm not worried about that patient. So I'm not seeing you. You just have pain. This pain is not going to cause your lung. It's not going to cause your life and high side because there's no evidence of shock. It's just pain. So I'm not seeing you. I will see you. You are a priority because you came into the emergency room, but I'm looking for the first person I need to see first. A client with acute appendicitis with a white count of 12,000. So where's the appendix? Appendix is here. And you have inflammation, highs. I expect the white count to go up. It can be 200, it can be 250. It's an infection. I'm not going to worry about it. If you have infection, you should have a white count. You have to be sharp. Even though white count infection is associated with the sepsis, well, you have to meet certain criteria to be septic. Your temperature has to go up, your heart rate has to have signs, and your blood pressure. None of this was given to me. All they told me is white count is up. I expect that with appendicitis. So this patient, we can see them first. No. A client with acute pancreatitis with shortness of breath. Well, you have an infection. It's a form of infection, but mostly inflammation. And I expect some kind of inflammation. But now you have shortness of breath. Well, that's in my B sharp, breathing issue. Why is this happening? Your diaphragm is here. And the pancreas is right here in the left upper quadrant. And then when it get inflamed, it affects the diaphragm. But then, because of the pancreatitis, they need a lot of fluid. So this patient may get like 300 cc of IV fluid. And this can push them into ARDS. Or they can get effusion from the inflammation of the diaphragm by the pancreas. So shortness of breath in pancreatitis is worrisome. It's a B sharp, a breathing problem. I got to worry about it. This is why B sharp is a versatile tool to analyze any questions, no matter what. A client with acute cholecystitis, we got to check our last one and make sure we don't have anything that will make B not that great. So you're looking for other things too. Cholecystitis with right upper quadrant pain radiating to the right shoulder. This is right upper quadrant. This is where the gallbladder. If you have inflammation here, it will go to your right shoulder. This is an expected finding. So 3 is the right answer if you are being sharp. If you are not being sharp, you choose other thing. As an entry-level nurse, you got to be sharp. You don't have to be an expert, just being sharp to find out something that is not right. A pancreatitis patient shouldn't have shortness of breath. You've done them something that you need to worry about them. So that patient, I'm seeing you first. And this is how you do the prioritization question. I don't like A, B, C. I don't think it makes you think. Critically, to be able to think critically, you have to have certain diagnoses that you can follow, you can focus on. Like I said, the B sharp is a versatile tool that make you focus. It keep you focused on certain diagnosis that you have to ask yourself, do I need to look at this again? ABC doesn't give you the opportunity. You want to think critically so that you can apply it. Okay, you have to um, start thinking that way, and that is what the exams is all about. And you don't doing these exams just to pass, then you throw it away. When you go to the world, they expect you to know all these things. They expect you to pick up with all these things you've learned. You apply it clinically. Science is not a vacuum, like I said. Everything is interconnected. This is how you do prioritization. It can help you do anything. So these are diagnoses that are very important that can cause morbidity and mortality to the patient. And so as you go through your prioritization question, it doesn't matter where it is, whether fundamentals, managed care, anything, you can apply it. You're thinking safety, and I have to be sharp. I have to be sharp. Once again, thank you for listening. Keep charging, and all the best of luck in your exams. Visit me back on my channel with content that will help you pass your exams. Thank you. Bye-bye.